Typically, how many pounds, people always ask me, how many pounds of skin is getting removed?
Yeah.
And do you weigh it?
I do, yeah.
Okay.
We always weigh it. I love weighing it. Yeah. That's a fun thing for me to do. I like to guess the weight and then weigh it. Yeah, because, you know, I feel that sense of, again, accomplishment for them of that skin coming off and them not literally carrying that anymore. It's never as much as you think it's going to be. So it's fun if someone, you know, if they guess the weight or whatever and they haven't ever been in there before, it's never going to be as much as you think it's going to be.
There's thickness to the skin that develops over time. Yeah. Correct? Maybe talk to me about that.
Well, yeah, just areas of the body have different thicknesses basically to them. So the eyelid skin is the thinnest skin in the body. The back skin is the thickest skin in the body. It certainly makes surgery different. Yeah. So operating on the eyelids very different than operating on the abdomen, different than operating on the back.
Right, right. Now the healing. You never know how it's going to heal, right? Sometimes you may need to go in, and especially if you're doing something all around, you don't know how the back is going to heal, how things come into play, if people want to continue to lose their weight. How do you handle something like that?
I always tell my patients, look, I want you to be happy as much as I can make you happy. And sometimes, especially with a tummy tuck, that central area will stretch some, and the scars just doesn't look that great. Right. So I do a lot of revisions in clinic. So I just numb them up in clinic. Once everything's nice and healed, that skin is loosened a bit more, so now I can take it a little bit more, and I just take that scar out and I can get it pretty darn thin then. One thing, when you do go all the way around, I always tell patients is, you know, it's kind of like I can't maximize in the front and I can't maximize in the back, so you kind of have to split the difference. Right. So I can get more if we were to split it up, really, like if we were to do the abdomen and then do the back later. Right. But yeah, you probably experience sometimes after you get the circumferential all the way around, you don't know, should I lay bent or should I lay straight?
Yeah. I mean, one thing I was telling another buddy of mine who got the surgery, said, you know, my squat depth wasn't as low because my skin is tight now. Yeah. So I actually had to re-stretch my skin because it was very tight. Yeah. You know, it was good tight, but, you know, not good for squatting. You know what I mean? Funny. So that was interesting. So now for women, I guess it's a lot easier because you can cut under there and maybe have a little more wiggle room because the breast lays over the scar. Right. But for men, what's your approach for men? I know for me, what they did was they took from under the arm and they kind of pulled the skin. We did a keyhole in my nipple, moved it, lifted up there, was able to avoid the scarring and stuff. So what's your approach with men?
Yeah, it depends again on the person. Some patients, same with men and women, really. Some patients will tell me, look, I'm not worried about scars. Right. Take as much as you can. I want to look great in this shirt. I want to look great in this dress. Right. And others are more concerned about it. They're like, I want to really love to go to the pool with my shirt off and not have a bunch of scars if possible. So sometimes in those cases, we'll do something more like what you're talking about. Let's try to pull from the armpit. Let's take as much skin around the areola, nipple area as we can and try to you know, minimize scarring. The caveat on that is, look, you might still have some extra skin when it's all said and done. You can't fully control that. And so we may end up having to come back and tweak it a little bit more in that case, and not everybody wants to go down that road. So it's, again, basically a patient-by-patient basis. You can definitely get the most skin out by doing the big Superman cut, you know, yeah. But not everybody wants that Superman, even though we call it a Superman scar, they don't want it.
I mean, some people say it's battle scars, you know. It's really, you know, to get the story to tell.
Yeah, well, I always tell people I have a scar down my chest from heart surgery, you know, and I always tell them, you know, it tells a story.
Yeah.